Welcome to the Doctor of Physiotherapy webinar. My name's Angela Stark. I'm the Clinical Education and Student Support Manager for this program, and I also look after all the applications for the program. I'm going to talk to you a little bit about the course and a little bit how to get into the program, and at the end of that presentation I'll be answering your questions, so feel free to log them as you go. So I've done a little bit of a summary of the things that I think you'll like about the Macquarie DPT or Doctor of Physiotherapy program. The first thing is that we're a fully accredited postgraduate program. We are the first Masters Extended in New South Wales, so there's only 3 extended Masters programs in physiotherapy in Australia, and we're one of those 3. That means you'll study a broader range of skills and you'll have a broader range of experiences than the other traditional 2-year Masters programs. The other great thing about the 3-year Masters programs is that it's aligning with international qualifications really well. So in the States now, and possibly in Canada soon, you will need to have a Doctor of Physiotherapy or a 3-year Masters program in order to work overseas. The other thing I think you'll like is that we've got great physio staff. So we've got great academics and great physiotherapy researchers who've worked in physiotherapy programs for many, many years. We've also got some fantastic clinical educators, so clinicians that are currently working in clinical practice in hospitals and in private practices, and they actually come in and teach some of our classes, particularly in the first year of the program. So you get to be taught by people who are actually working clinically at the moment, which we feel is a really important aspect of teaching in our program. The other thing is we have great student support services, and I can say that because I'm the person who looks after those. But we have great student support within physio and also as part of their campus wellbeing offered by Macquarie University. We have an innovative and extended curriculum. So because we have a 3-year program, we've got a little bit of extra time to explore some more what we would call maybe extended scope practices, and also to go into things in a bit more complexity. So the sorts of things you will do in our program that you wouldn't see in other programs is we spend a bit of time in your final year looking at pharmacology and imaging, and you'll do a business management and law for physio subject. We do some leadership policy and advocacy, and you also do some extra clinical time, and all of these things make up for an extended and quite innovative curriculum. And that's all on top of the usual core physiotherapy subjects that you would be doing in a physiotherapy program. The other thing that's a little bit different in our program is that we have a research project, and we need to have a type of research project as part of a 3-year Doctor of Physiotherapy. It requires, our qualifications framework requires that we do some research, but it's a very well supported research program. It's well supported by the academics and by some of our clinicians in the field. That's often a part of our program that the students worry about, but I'll just assure you that it's a well supported program. Another thing you'd like about our program, I think, is that you'll have plenty of clinical experiences. Again, I can tell you that because that's the other portfolio that I look after. So in 5 out of the 6 semesters, you'll do some clinical placements, and clinical placements start in our course in week 5. So in the very first semester, by week 5, you'll be going out and having some various clinical experiences. We have over 1,000 clinical hours, which is important, especially if you want to have a portable degree. If you want to work overseas, especially in Canada, you need over 1,000 hours of clinical time logged, and you'll get that. You'll get a variety of experience, so you'll get experience in musculoskeletal, cardiorespiratory and acute care, and also in rehabilitation, which are the core areas of physiotherapy. But you'll also get experience in some other areas that we would commonly call elective areas, like pediatrics or spinal cord injury or sports. And those kinds of areas you would be doing in the final semester, and also some international placements. And many of our students are coming in from Canada. So at the moment I'm looking at placements in Canada, and also maybe in Malawi is the other place we're looking at some placements. We have state-of-the-art and purpose-built facilities for teaching. So we have some, and on the presentation there you can see our beautiful teaching rooms. We have 3 teaching rooms that are just for our students. So we use them for teaching, but they're also available for our students to use to practice prac exams, or to come in and do some practice before you start a class. We're right next door to Macquarie University Hospital, and so proximity to possible clinical placements is also good. We have extensive office space and hot desking available for students, and also in the hospital, in the clinics building, which is next to the hospital, there's some anatomy wet labs. So when you finish your clinical placements at the start of second year, you'll come back onto campus and spend some time in the wet labs brushing up on your anatomy. The other thing that's great about our program, and I think it's our real point of difference, is that we're a small cohort. So we take in maximum of 66 per cohort. That means 22 people in a tute group. So we have 3 tute groups at any one time. What this means for our students is that they get lots of personal attention and they get lots of opportunities for feedback. It also means, from a more practical point of view, that our timetabling's really efficient and effective. There's no gaps in the timetables. We have you on campus for long days, but at the most 3 days a week, and the other days of the week are set aside for independent study or to do some clinical experiences. A happy product of starting our course in the middle of the year is that you also graduate in the middle of the year. This is particularly good for work opportunities. We're the only program, apart from University of Canberra, that graduate in the middle of the year. And so what we've found with our last 2 cohorts that have graduated is that they've got jobs within a month of graduation, and most of them have had jobs teed up well and truly before then. So that's been a really good thing. We've found our students are in hot demand in the middle of the year because there's not many other graduates around for employment. If you've not been to Macquarie University, it's a really beautiful campus and it has really lovely facilities. So there's lovely facilities in our physio rooms, but the campus is also really beautiful. There's some pictures of the campus there. There's a fantastic campus hub with lots of places to eat, and a really good aquatic centre and gym. And we're really close to the train station, and we're in lots of kind of open park. There's lots of lovely open parkland in this area of Sydney as well. So we're lucky to have really beautiful campus. The other thing that I think you'll really like about us is that we really go to great lengths to help you settle in to our course and to the university. So university orientation, of course, but then we run our own, what we call conference week. In the very first week of the course, you spend the whole first week together as a group, getting to know each other and getting to know all the staff. And after that, we move into more traditional lecture tutorial kind of series. We also have, to help settle in, we have some mentors in years above to help look after our new students and to answer any questions. And we have some good student networks. Our student group is called Macquarie, and that we have year reps in each year that I regularly meet with and get feedback on how people are going. And we also have a pretty open door policy in our department in terms of being able to make appointments and pop in and see people when you have questions. Right, so that's that's really all the things that I think you will like about the Doctor of Physiotherapy. Now a little bit of information about how you can get into the course. You need, and I'm sure a lot of you, if you've had a look at our website, will be aware of this, but basically you need an undergraduate or a graduate degree with a GPA of more than 4.5 out of 7. That's about a credit average. You need at least a minimum of at least one tertiary unit in the following areas. So human anatomy, human physiology, psychology and research methods. Now the GPA and the human anatomy in red, because I'm going to talk about them a little bit more. We also need an Ielts band 7 with no component less than 7. So that's quite a high Ielts to get into this course. And there's a number of desired subject areas too, and they're listed there on the screen. You can see them. They are not, obviously they're not essential. You don't have to have them, but if you have them under your belt, it is easier when you're sitting in the classroom and you're listening to the sort of things that you're learning about. So it's much easier to deal with the content if you've done them. But they're not essential to do. I'll just talk about some of the types of courses that people have done who've come into our courses. Are all the traditional health sciences, clinical science, exercise sports science, all those. There's just some examples there. The sorts of courses, and the ones in red are ones that are at Macquarie. The sorts of courses that often don't meet our prerequisite knowledge requirements are things like medical science and science, unless you choose the right sort of units to meet our requirements. In these courses, there are a lot more build your own, and they sometimes don't have core units that specifically address our musculoskeletal anatomy requirement. So if you're doing those courses, make sure you're careful to choose the right types of subjects or units that will meet our requirements if what you want to do is physiotherapy. So a little bit more about anatomy, because this is the prerequisite I spend most time on and advising people about. So with our human anatomy, there's two aspects we need you to have covered. We need you to have covered the anatomy of the body systems, but we also need you to have covered in detail the musculoskeletal anatomy of the vertebral column, upper limb and lower limbs. So the anatomy of the major body systems is often in a subject that's called introductory anatomy or anatomy and physiology 1 or 2, or something like that. The musculoskeletal anatomy is usually a standalone anatomy subject, and it covers muscles, bones, nerves, blood vessels of the upper limb, lower limb and the vertebral column. So I want to be really clear about that, because lots of people apply thinking they've done human anatomy as much as we require, but we need that depth of musculoskeletal anatomy especially. This means that most people have completed at least 2 and often 3 units in anatomy in order to be eligible for our course. And I'm especially tough on human anatomy because it's really hard to keep up with the content in our course if you don't have a good grasp of musculoskeletal anatomy in particular. The GPA, so UAC, our applications go through UAC. They calculate our GPA. They have a GPA calculator on their website now, which is really good. So you can actually plug in your numbers and see what GPA they would calculate for you. To be eligible, you need a GPA, as I said, of 4.5 out of 7. To be competitive, it needs to be higher than that. We get many more applications than we can take. So to be competitive at the moment for our current intake, I've just got some numbers up there. You'd need a GPA of about 5.5 out of 7 for a full fee paying place. And for a CSP, you're looking at 6.5 out of 7. We only have a limited number of CSPs, which is why it's so high. When you apply, UAC will assess each of your, if you have more than one undergraduate degree or if you've got a number of different types of study, they will assess your GPA and calculate it separately for each different piece of study, and then I will take the highest GPA you have, regardless of what area you've studied. So as long as you've studied all of our prerequisites, if your highest GPA comes from a Bachelor of Business, that's the GPA for entry that I will take. The other thing about GPA calculations is that I will only look at pieces of tertiary study you have done that are more than 1 year, the equivalent of more than 1 year of full-time study. So you can't just go and do a couple of units in a Masters of Exercise Physiology, for example, and get really good marks and then use that as your GPA for entry. You need to have done a significant amount of study for it to be considered for your entry GPA. CSP, so we have a limited number of CSP available, and they are distributed based on 2 different areas. So the first one is the first one's merit, so the majority of people are awarded a CSP based on merit. We also have some equity CSPs, and they are handed out based on Indigenous Australian applications, and also for regional and remotely disadvantaged applicants. So for information about the equity CSPs, go to the UAC website. There's a form you need to download and fill in and submit with your application, and you need some supporting documentation to support either of those 2 aspects of the targeted equity areas. You'll only need to, the other thing to know about CSP is that I assume everyone would like a CSP. So when you apply for UAC, you don't really need to separately apply for a CSP and a DPhil. Just apply for one or the other, and you'll receive a CSP if you are ranked high enough to get one. Otherwise, you will receive a full fee paying spot. I've just popped in at the end some frequently asked questions because I actually deal with probably 90% of the inquiries into our course, and these are the things people ask me the most. So the first one is, how can I improve my GPA to make me eligible or more competitive? And the only answer to that is you can't change a GPA that you have on a completed program of study. You actually need to get yourself a new one. So the only way you can do that is to do some more study, and it needs to be significant study for more than the equivalent of 1 year of full-time study, and that'll gain you a new GPA. I haven't completed all the prereq. Should I still apply? The short answer to that is no, because you won't. If you haven't got the prereqs, your application will be rejected. How can I meet a specific prerequisite? If you know you haven't got a prereq area, then you can study that area. You can do that in any way you like. You can do it as part of a degree. You can do it as a non-award unit. You can do it as online. So if you can find an online course where you can meet the prereqs, or you can do it in face-to-face classes. Now, if you're as long as you're enrolled in that unit, and you will be finished that unit by the time our course starts, you could still be made an offer. It'll just be an offer conditional on successful completion of that particular prerequisite unit. The same thing happens if you're still studying your undergraduate degree when you apply. If you meet all other requirements, you would just be made an offer conditional upon completion of your undergraduate degree. How do I know another question I get is, how do I know if a specific subject meets DPT requirements? The best thing to do there is firstly to have a look at our supplementary form, which you can get off UAC or you can see on our website. and read the definitions. There's some definitions there at the end of the supplementary form. If you're not sure, you just need to log in a question through ask.mq.edu.au, and that will come to me, and I will I'm happy to have a look at any subject descriptions or unit codes, and I can tell you if they meet our requirements or not. That's all the presentation that I have for you this evening. If you'd like to submit your questions, we can have a look at, I can have a look at answering those for you. I'm just getting them up now. What I'll do is I'll read out the question and then I'll answer it, so I can see the questions up in front of me now. So my first question is, I'm currently in medical science in my last year. I finished Intro to Anatomy, Systems in Physiology, Neurophysiology and Psychology that is related. May I ask you to advise some more courses that I can prove my application? This is a classic issue for medical science student. I would definitely suggest, Anne, that you did another anatomy unit, and it needs to be called something like Musculoskeletal Anatomy or Functional Anatomy, they're often called. So I'm not sure where you're studying, but have a look at some more musculoskeletal related units. If you're not sure, if they meet requirements, log an inquiry through ask.mq, as I said before. So the next one, Anne said, oh, how surprising we can do pharmacology. Is there a chemistry aspect of that? So pharmacology isn't a whole unit in our course. It's a lecture, and it's pharmacology that's related directly to physiotherapy. Physiotherapy is also looking at some extended scope sort of practices in this area in pharmacology. So and in prescribing. So we have those sorts of topics in our course that extend your knowledge a little bit further with a view to where physiotherapy is going in the future. That's one of the good things about having a little bit more time to do some more work in other areas. Oh, Bona, as I've got another question here. As one of the prerequisites for this course, at least one unit in research methods must be completed. What are the possible units to complete in order to fulfill this prerequisite? There are so many of them. I couldn't list them. There's a lot of, all universities will have a research methods course. Again, you would have to send me a description, or you would need to read the description on the supplementary form and see if you meet the requirements. Very basically, a research methods course is something like that covers qualitative and quantitative statistics. It might get you to look at some research papers and be able to read the statistics in those. So yeah, there's a lot of scope for the type of research projects, the type of research methods units you might have completed. If you're not sure, again, ask.mq.edu.au, and I'll have a look at your unit description for you. I've got no more questions at the moment, so if anyone's got some questions, make sure you pop them up. Here we go. Here's another one. Another one from I do medical sciences. Is doing the systems, neuro and advanced physiology classes meet as the requirements for physiology aspects of the degree? Again, it's really hard for me to know what's exactly in those units, which is why in your application I ask you to tell me the unit code and name, but also a little bit of a description. Now, I would hazard a guess that in a medical science degree, that if you've covered all of the all the major body systems, and you've also done advanced physiology, then yes, you've probably met our requirements, but I can't tell you that 100%. at the moment. Sarah's asking, what would the weekly schedule look like for the program? That's a good question. So basically in your first year, you would be on campus Tuesday, Wednesdays and Fridays from around 8 or 9 till 3 or 4, depending on which tutorial group you were in. There's no gaps in that, so basically there's an hour lunch in between, so there's no big gaps for you to wait around. On average, I always say there's about 18 hours of face-to-face teaching in the course per week, and then we would expect about that in independent study and some clinical experiences as well. So it's a true full-time course. Because we're a small cohort, as I said, we can make our timetable very tight, and we do try and we do understand that students need to work and sleep and have fun and eat, so we try and keep the timetable. We're very mindful of timetabling things quite well. So Jamal's asking, I'm currently doing Bachelor of Human Science with a major in Human Movement. That's here at Macquarie. Excluding the major, are there any electives that would aid us in applying for Doctor of Physiotherapy? And Jamal, I've actually given your course coordinator, so your Bachelor of Human Sciences coordinator, a list of electives that I've had a look through and thought would be quite good. But my other theory is to think strategically and choose subjects that you think you would like, because if you're doing the Bachelor of Human Sciences with a Human Movement major, you know definitely you've met our prerequisites. It's one of our feeder degrees. So my advice would be to choose things you think you would really like and that you will do well in, because having a good GPA is also a very important aspect of getting into the course. So you could check with Melissa, your course coordinator, for the list of electives, but also consider what I've just suggested as well. Justin's completed another one, a bachelor degree with honours. Will the GPA be calculated from all years or the degree? As far as I know, yes, UAC will calculate from all years of the degree, not just the final 2 with honours year. UAC use an unweighted GPA as well, so it doesn't weight different years differently, so it's just a straight GPA. That would be a good question to ask UAC as well. Do you get to choose the location of your clinicals? You get to preference where you would like to go for your clinicals. You get to choose in some ways, particularly in your last year, if there's a particular area you'd really like to do, like pediatrics or spinal cord injury, or maybe you're really interested in amputees or some other aspect of physio that's a little bit unusual, then I will try and source placements in those areas for you. That's part of my portfolio. So yes, you do get to choose the location of your clinicals in some way. Our clinicals are spread right across the Metro Sydney area. We don't have many in rural areas, and we are working on international ones, as I said before. So there's a lot of choice in places you might go for your clinical in Sydney Metro. Yasmin's asking, is the Bachelor of Human Science with a major in Human Movement units offer enough to head into physio? Yes, that course is a feeder degree for our course. It doesn't guarantee you entry. It guarantees that you've covered all of our prerequisites if you do the Human Science Bachelor with the Human Movement major. Yes, but you still need a competitive GPA to get in. That's all the questions at the moment. Oh, no, I've got another one. Christy's asking, how are the job prospects for physiotherapy, and are there certain physiotherapy areas that are in high demand? That's a great question. Job prospects are, despite the large number of physio graduates, job prospects are really quite good still in a lot of areas of physiotherapy. Aged care is a really growing area. So that's probably where a lot of the demand is coming from. If you're interested in sports, as probably a high proportion of our students are, that's an area that's a little bit harder to get into, though our course has a specific sports placement that does help you enter that area of sports physiotherapy if that's what you want to do. Prospects, as I said, are particularly good for our graduates because our graduates come out in the middle of the year when there's not very many other graduates on the market looking for jobs. So our students get snapped up pretty quickly into employment. I'm just looking for the next question. So Deepika is asking, which hospitals or clinics does Macquarie University associate with for clinical placement? Oh goodness, we've got about 300 clinical partners. So some of our major hospitals are Macquarie University Hospital, which is on our campus, Prince of Wales Hospital, Liverpool Hospital, Westmead Private. There's many hospitals that we're associated with for clinical placements. Madeline, if you need to take a semester off, is that doable? It's doable. You can't actually take a semester off our program. You would need to take a year off because our units are only offered once a year. We have people who have done that in the past, often because of family issues or personal reasons, and then they can re-enter the course. So at the moment we do keep your spot open if you need to take what we term an informal leave of absence, but it's not the best option because you then have a bit of a gap in your learning, but it does happen at times, and we do accommodate that where possible. Any other questions for people? I don't think I've got any more there, so put your questions up. Oh, hang on, I think I've just got another one. Well, someone's asking, what does domestic fee-paying place mean? So DFP means that's a full fee-paying place for a domestic student, as opposed to a Commonwealth supported place, which is funded partly by the government. Kim also comes from a medical science background. What subjects can I do at Macquarie University for musculoskeletal, and can I take this as a bridging rather than non-award study? You can't do a bridging course. It won't be long enough for the musculoskeletal anatomy prereqs we need. It will need to be non-award study, and you can do HLTH 108. I think it's called Anatomy of the Limbs and Back, but that's the unit here at Macquarie you can do for musculoskeletal. You don't have to study here at Macquarie, though. We know that anatomy course really well, and it sets you up very well for our course. I'm just looking to see if I've got more questions. I think I've answered all of them. Oh, here's another one. I have a PhD in radio neurochemistry, done about 30. I can't read that question. I've just got one more question down here to read. I have a PhD, done about 30 years of research was an honorary associate professor for 7 years. Never had a formal course in it, mostly self-taught. I'm just reading that question, it's a long one. My GPA was 4 out of 5. I stand a chance of getting accepted. Past 70, but things I'm not. Unfortunately, with our applications, we need formal study. We don't have any other way of determining eligibility. So even if you've done lots of self-study with Grey's Anatomy and all the rest, at the moment, the only option we have is to look at people's tertiary education in order to get in. But that's quite a complicated question. So Nabil, if you'd like to log an inquiry through AskMQ, then you could do that. Let me see. Lindsay. For current Macquarie students who have a GPA from previous 4-point scale, how does this compare to the 7-point scale entry requirement? Just do a straight calculation. That's how we've been working it out. So a 2.5 out of 4, I think we've vaguely converted it to 4.5 out of 7. But if you convert your GPA, if you divide your current GPA by 4 and times by 7, you would get about what your new GPA would be. But UAC will calculate that off your raw marks in any case. Darius is asking, I'll be starting this course in second semester. Well done, Darius. Is there any areas of study you recommend to revise before commencing this course? Yes, definitely. So when you enroll in our course, you will access our induction manual and also its companion document, which is a self-directed learning module in musculoskeletal anatomy. I would strongly recommend that you work your way through that self-directed learning module. Apart from that, I think the important thing might be, while you're waiting to come into the course, is to have some rest and R&R, have a bit of rest, have some fun, make a little bit of money. So maybe work a little bit, make some money, so you're well set up for the course. My students tell me that the content's not hard, but it moves very quickly, and you don't have as much time as you did in your undergraduate course to work. So most of my students work, but they can't hold down. They can hold down a part-time job, but maybe not as much as you are working in an undergraduate degree. I think I've got another. So someone's asking, has enrolment open yet for tutorials and other classes? Deepika, you'll notice that enrolment has opened. Class registration is very specific for our course. So if you've read the induction manual, you'll know that you don't register into classes. You actually put in a preference for which tutorials you would like, and we register you in your classes. And we do that for a very simple reason, and that is to make sure that you are registered in the same tutorial group for all 4 units in the semester. So our students spend each tutorial with the same group of students, and that's to allow us to it allows us to organise your clinical placements easily. So have a look through the induction manual if you've enrolled, and it will give you some more information about that. There's also a timetable in the induction manual, so you can see what potentially your timetable would be like. Jamal's asking, what's the average number of applicants you receive each year? People often want to know this, and I'm not sure how it's helpful. I get about 400 applications. I'm not sure how that's helpful. It probably makes you more stressed, but not all of those 400 are eligible, but it's high intake of applications, and that's just for domestic. International, I get over 100. So lots of applications would be my short answer. Jasmine, is there penalties for being unable to attend a week of the semester for educational purposes? I will be taking a football conditioning course in August. There's no penalties. It's postgraduate education, so we don't mark a role. But missing, just a warning, missing even a course, even a week in this course is quite hard to catch up. It's not a course that moves slowly, as I've said before. So unless there's an assessment that's due in August, it shouldn't be a problem. You just need to keep on top of the things you're missing. If you miss an assessment because of a football conditioning course, we probably won't be able to accommodate that. I've got another. Madeline's asking, do you have a lot of medical science graduates in the course? Yeah, we have a lot of medical science. We have science and medical science, and we have exercise science and sports science, human movement degrees, health science degrees. So the exercise and the health science degrees are probably the biggest proportion of people, but then medical science and science graduates also in our course, and everyone, as long as you've done our prerequisites, most people do well in our course. Any more questions? I think we've only got about 5 minutes to go, so hit me with your questions. I'm just looking to see if I've got any more. Daniela, do you need to keep studying once we graduate to keep accreditation? Once you graduate, you're not accredited, you're registered. So you're registered as a physiotherapist by APRA, which is our registering body. And yes, you need to keep studying. You need to do at least 20 hours a year of continuing professional development, which most people don't find difficult to manage. I'm just looking to see if I've got some more questions. What's the average number of applicants? Do many graduates get jobs through their clinical hospital placements? Some people get jobs through their placements, through their clinical or their private practice placements. Yes, sometimes. When our graduates are due to finish, I send out an email to all of our clinical partners and say everyone's about to. We've got a new lot of graduates about to come out. Who, if anyone wants to employ them, let me know. And so we often get a lot of job ads that way that come directly from our clinical partners because they like our graduates, they spend a lot of time with them, and they like what they're doing. Someone asked what's a competitive GPA at the moment. That was in my presentation. At the moment, for a full fee paying place, so a DFP, you would need a GPA of about 5.5 out of 7. I'm not sure how that's going to change. I haven't looked at the next lot of applications. And you would need, for a Commonwealth supported place, a GPA of about 6.5 out of 7. So the numbers are quite high at the moment. Jess is asking, when will the next round of applications be released? Will that be the final round of offers? So applications close for domestic applications on at the end of March, and then I will start making offers in early April, in the first 2 weeks of April. We'll make a couple of rounds of offers, but we have very limited placements. We have limited spots in our course, so we limit it to 66. So we will be metering them out very, very slowly to make sure we don't over-enroll. So I apologise if you're getting frustrated because you're on hold or you haven't been told, but we will, we'll be doing it as quickly as we can. Harrison saying, not sure if it's already been asked, but the current timetable has all tutorials currently full. Any idea when our new classes will be released to enrol in? Now, Harrison, if you need to read the induction manual. There's a big section in red that explains why that is, that the tutorials are full. It's because we, after many years of trying to get students to enrol in the same tutorial group, for all 4 units, we've decided to do it ourselves. So what you need to do is look at the induction manual under enrolment and class registration, and you need to fill in a survey and tell us which classes you would like to be enrolled in, and put in those preferences, and then we will release the classes. The timetable is not particularly different for the 3 groups in any case. So if you have a look in that same induction manual, it shows you the master timetable, and you can get a good idea of when you might have to be on campus. just looking at to see if I've got any others, but I think, what does it take to be successful in this program? Sarah's asking. I think it takes some dedication. You need to be organised, and you need to be present. You need to be and focused. We really look after our students. We support our students. If you're struggling, we offer extra help. If you make it into the course, then you're well and truly, we think you're well prepared to keep going in the course. But we also offer you lots of support to do that. It's a very cohesive cohort. Our students study together. Everyone's very focused on the job at hand, which I think makes it a really nice environment to learn in as well. I can't see any more questions, and it's now 7:45, so the webinar will just wrap up a little bit. So thank you for attending our Doctor of Physiotherapy webinar. We hope you got all your questions answered. If not, you can email us at postgraduate@mq.edu.au if you have any further inquiries. And just before you leave, it would be really helpful to us if you please quickly do this quick survey below. So thank you very much for coming, and good luck with your future study and good luck with entry.